What is a normal-sized penis? Pornography has really blurred the lines of what exactly is a normal-length penis. There are few topics that can evoke such widespread and intense anxiety as penis size. Just about every man, regardless of the actual size of his penis, worries about being too small. Here's what you need to know about penis size, and what to do if you're afraid your penis is smaller than normal. In this video we will look at some evidence behind so-called penile lengthening treatments. Did you know that a survey of 50,000 heterosexual men found that 55% of them were unhappy with the way their penis looked? But when asked, 85% of women were satisfied with the way their partner's genitals looked. At the end of the day though, all that matters is how you feel about your own appearance. So, what is an average penile length? Most men seem to think 6 or even 7 inches is average, but that's just not the case. If you look at the data, the average penile length is about 5.2 inches. It's also normal for penile length to be within 2.5 inches of that, either greater or smaller. According to research, the size of your penis has a surprisingly small effect on the amount of pleasure your partner is capable of feeling. The size of your penis also has absolutely no effect on the amount of pleasure that you're capable of feeling. Having a bigger penis doesn't equate to feeling more pleasure during love making. Well then, what's considered abnormal in terms of length? It is anything less than 2.9 inches. This is called micropenis. Micropenis is prevalent in less than 0.14% of the population. So, it's extremely rare. This can be due to a number of causes, including congenital abnormalities, hormonal abnormalities, surgery and/or cancer. But in this video, we're going to talk about men who have a normal penile length, but are unhappy with their size. It is important to note that the large majority of people who are concerned with the size of their penis have a normal penile length. The true issue is that a significant portion of men can have distress related to the idea that their penis is not as long as they desire. This is a form of body dysmorphic disorder. It is called small penis anxiety, but it doesn't mean that they have a small penis at all. They just have anxiety related to the fact that they believe that their penis is not long enough. These men have a preoccupation or obsession with the size of their penis. Actually, some of these men can be so distraught that it can affect their daily activities, and as a result some can end up in hospital due to their overwhelming obsession. Some men even have suicidal thoughts. This can be very serious, so it's important to talk about this as a serious part of men's health. Please do not search on the internet, "how to make my penis longer," because you will be inundated with hundreds of websites with information that is usually not reputable. Look for a reputable urologist, psychologist to help you with these issues. Surgery is not recommended as it is considered experimental unless it is for someone who has a micropenis. There seems to be 2 categories of treatment options available for people who suffer from small penile anxiety or distress. There are non-surgical treatments plus some surgical options. Let's start with non-surgical treatments. Psychological counseling. Psychological counseling and assessments can be done to help you understand what a normal penile size is, and also to help you deal with some of these anxious feelings. Usually when men have undergone psychological counseling and nothing else, the large majority of them no longer feel they need any other treatment, whether it's non-surgical or surgical. This is very important, so it is normally recommended that anyone suffering from anxiety to please seek out psychological care to help deal with this anxiety. Other non-surgical options are penile extenders, vacuum erection pumps and penile injectable treatments. The only one of these 3 that has any data to suggest that it actually results in penile enhancement is penile extenders. Penile extenders are a device that has a hole in which you put your penis. It also has 2 rods on either side and then a silicone circle at the end to hold the glands in place. It slowly applies traction to the penis to provide length. It does this over many months, with a lot of time dedicated to it each day. According to the data, people who religiously used these penile traction devices actually did gain some length on their penis. You can measure your penile length by its flaccid length, as well as its flaccid stretched length. In urology, this flaccid stretched length is used to estimate the size of an erect penis. So, what can you expect after months of daily use of a penile traction device? Well, only about 2 centimeters. So, the gain is very small. Plus, you have to be extremely committed to do this daily for several hours a day to achieve this effect. There can be some complications, however, which can include numbness, bruising, or overall lack of efficacy. You may also not see any benefit at all. However, this is the only treatment that has been shown in medical literature to have consistently good results with very low side effects. There is no evidence that vacuum erection devices increase penile length at all, other than in the case of erectile dysfunction, and then with very little effect. There are a number of different penile injections that have been tried in the past, but many of them have devastating complications, so are not recommended at all, except under the supervision and care of a urologist. Complications have been reported up to 40 years after using a penile injection. The most common surgical treatment is a suspensory ligament incision. The penis is held to the pubic bone by a ligament. By releasing this ligament, you can get a little more length to the penis. However, this procedure can also have complications and is most commonly used to treat micropenis. Most other surgical techniques also have very poor outcomes. So, really, there's not a lot you can do to change the length of your penis. You may gain a small amount of length with traction therapy, but is it worth all that work? My advice is first and foremost getting treatment under the care of a psychologist and urologist to deal with this anxiety before doing anything. Remember, what you do may be irreversible. You may end up with something that is disfigured and not functional. It is recommended that you consult your physician or healthcare professional. If you have or suspect that you have a medical problem, promptly contact your healthcare provider. The information contained in this video is for general information and for educational purposes only. Nothing contained in this video is, or should be, or considered, or used as a substitute for medical advice, diagnosis, or treatment.